Hi, this is Linda Adams, and I'm here today to share some tips and tricks for helping the low back let go, and specifically for addressing sciatica. And this isn't a cure, and it doesn't replace your time with your doctor or their advice, so please seek that. But it's something that I found helpful over time with many people. And this has to do with my work with the body being holographic. And so we're going to use some maps on the body to help release those areas that can contribute to sciatica. And so I'm going to do the right arm, and that's for the right side of the body. If the sciatica is on the right or the low back pain is on the right, then this would be helpful. Otherwise, you would do it on the other arm, the left arm for the left low back. So you want this part available and visible. And noting where the crease is here, we're going to go on this outer part. If you put your fingers in there, you're going to find a kind of ropey area. And if that's really, it corresponds with muscles in the low back. And if it's tight in your low back, it's going to be tight and tender here. And you can just do what I'm doing. Just kind of go over it like this, kind of snapping over the muscle and the tendon a little bit. And just noticing how tender that is, just noticing what it's feeling like. And then you're going to pull, going to make a fist, and you're going to pull your arm toward your shoulder. And at the same time, you're going to push away. So you're creating this dynamic tension, and slowly you're going to let your left arm win. And slowly, with the resistance still there, you're slowly relaxing until your arm is straight, and you just let it go to rest on your knee. And you're going to find that it's like mine is, it's already way less tender. We're going to do that again. Put your hand there. You're going to pull toward you, and then you're slowly going to relax, keeping the dynamic tension between the two forces. Just kind of feeling into those areas, even less tender. The next we're going to address is there's a muscle that runs at about this kind of diagonal here, and this corresponds with the psoas, which is the tenderloin in animals, and it's kind of tender in us too. It's one of the deepest muscles in the body, and it's one of the core muscles, and it has a lot to do with low back pain. So first we're going to do what we did before. We're just going to go back and forth across that and notice how tender and how ropey it feels. And then we're going to do the same thing. We're going to pull, keep your thumb on there at that kind of diagonal that the muscle runs. You're going to pull toward you, and at the same time you're pushing away. And slowly you're going to relax, keeping that dynamic tension between the push and the pull. Slowly letting it go till your arm is straight, letting that all relax. Noticing how that is. Pulling again. This time we're going to turn so that this part of your arm is facing away. Same thing. We're going to push and pull and slowly let it go. Rubbing in that area. And then you're going to find where is the most tender spot on that. For me, it's way up toward the crease here. So I'm going to put my thumb on that most tender spot, not pressing in to cause pain, but just to bring awareness there. Pulling in, kind of tightening. This time we're going to tighten our jaw. And slowly let it go, let the jaw release, kind of squeeze here. Yes, that really, really helped. I can already actually feel more space in this part of my body. So when we're done, I'm going to do the other side. And that is something that would be good to do on both sides, because if you release one side completely and you don't address the other, you could imbalance the body. So you want to do it on both sides. You could do an extra amount on the side that's most tender, but definitely you always want to do both. And the keys that make this work are being present in your body and really tuning into how and what you're feeling, both in the area of discomfort and also in the area that we're working. Also, your intention. That's very, very important. And consistency. If you do this that's one time, it's not really going to make, you're going to feel a difference, but it's not really going to change things long term. But consistency, doing it every day, even doing it twice a day, twice is more than twice in terms of its effect. The second time is actually kind of exponential if you keep that up twice a day. Over time, the body lets go and remembers to stay relaxed. At first, it may tighten back up. You do it and it relaxes, and you do it and it tightens up, and then it relaxes. So the consistency is the key. And I thank you for tuning in with me today. And if you like that video, make sure to like it on YouTube and to share and subscribe if you want more videos like this. Thank you so much.